Welcome to Ahava Med Spa by Inland Cosmetic Surgery.
This is an educational tool to demonstrate the effects of facial aging process. In youth, the face looks like an upside-down triangle, with the base of the triangle resting on the high cheekbones and gradually narrowing towards the peak, which rests over the chin. This demonstrates a youthful appearance.
Facial aging affects several types of tissues, including skin, fat, muscle, and bones. As we age, these structures change with each passing year. In this slide, you can see how that affects our face in our 20s until later in life. Some of the changes to our skin that happen with age are that skin becomes thinner, our skin becomes drier, less elastic, and we also lose collagen, which result in more wrinkles.
As we age, we also lose fat in our faces. The face contains more than 20 compartments of fat. Some of those fat compartments are superficial and some are deep. But as we age through the years, we tend to lose the fat, and the compartments, instead of being smooth, become further apart, and that results in bulges and delineation, such as the bags under the eyes and other areas that appear sagging and separated, like the jowls. With aging, we also lose bone. Our bony skeleton provides support for the overlying structures, muscle and skin, and as we lose bone, we lose that support, especially around the eyes, cheeks, and the jawline.
This is a mother-daughter comparison showing the signs of aging with a mother and a daughter. On the left-hand side, the daughter's face, you could see that her nasolabial folds are very softened. Her cheeks sit higher. Her under eye is very smooth. It's not hollowed or have bags. And her jawline is very sleek, and there's no jowling. On the mother's side, on the other hand, you can see her nasolabial folds have deepened due to the volume loss. Her under eye, there's bags under her eyes, you could see that, and her jowls, you could see that they sit lower, and this is also due to the volume and tissue loss as we age.
This slide demonstrates the same mother and daughter image with the triangle of youth superimposed on the daughter's face, where you see the high cheekbones, the well-defined jawline and chin, whereas in the mother, the base of the triangle is now at the bottom because of the drooping of the skin, the jowling, and loss of volume. So in fact, she has more of a squarish look than the triangle with the base over the cheeks. In the three-quarter view, some people refer to the rhomboid as a sign of youth. The rhomboid again represents the parallel lines of a high cheekbone and a very smooth contour over the jawline, as well as a smooth transition from the nasolabial fold to the back of the face.
Here are some youthful faces that you may be familiar with. In this picture, it's Penelope Cruz, and you could see her beautiful high cheekbones as well as a chiseled jawline.
Here is a slide showing Julia Roberts, and she demonstrates the triangle of youth as well as the rhomboid in this view, with a very smooth contour to her under eyes, a transition to high cheekbones, and natural looking nasolabial folds and a strong jawline.
Here is a youthful picture of Angelina Jolie demonstrating her beautiful youthful skin with high cheekbones, perky lips, and a chiseled jaw. These types of results can be achieved by a combination of skincare, wrinkle treatments, and fillers, as well as other non-invasive techniques which will be discussed.
For example, the use of neurotoxins is the most common cosmetic treatment today. Treatments like Botox, Dysport, and Xeomin can smooth wrinkles in the forehead and frown line area. They can soften up the lines around the eyes, as well as treat areas like the jowl and necklines, as well as wrinkly chins. This slide demonstrates some of the areas that can be treated with neurotoxins. The effects of neurotoxins can last anywhere from 3 to 4 months and need to be repeated. Neurotoxins treat dynamic lines on the face, meaning lines that are accentuated by movement, such as the crow's feet or the frown lines or the 11s, but they do not treat static lines like the nasolabial fold or the laugh lines. Static lines, such as the laugh lines, can be treated better with fillers. Fillers can treat multiple areas on the face as demonstrated by this slide. As we demonstrated earlier, as we age, we lose volume in our face in multiple areas. So we can replace that volume loss, for example, in the temples, in the cheeks, as well as the nasolabial folds, marionette lines, and lips. Those are the most common areas we use fillers. We can also use them in other areas, such as the hands, where we can replace the volume lost and improve the contour and coloring of that area. There are many options of fillers that are available, such as hyaluronic acids, as well as calcium hydroxyapatite and others. Your provider will go over all these options and will help you decide which filler is best for which area.
In our practice, we oftentimes combine fillers and toxins to give the best results, which address structures affected by facial aging. For example, some patients like to get their Botox in their frown line area, as well as treat the volume loss in their cheeks or nasolabial folds to give a more youthful appearance.
Skin is the biggest organ and the most visible in our face. Skincare is a lifetime commitment. Skincare products and skin protection are key to maintaining good results. You can discuss different options of skincare treatments in our office with your treatment consultant. Skincare treatment starts with a simple regimen of protection during the day and treatment at night. In addition to a full line of skincare products and custom-made compounds, we offer facials and peels, as well as microneedling and laser skin rejuvenation. We sometimes combine PRP, which is platelet-rich plasma, with microneedling to help rejuvenate the skin as well as thicken the dermis. All of these treatments are geared towards reversing the facial aging process and maintaining good skin texture and color. Your provider can help you decide which options are best for you. Here's an example of the type of results you can achieve with a series of VI peels. You can see on the left the multiple areas of pigmentation and lines and wrinkles in the forehead, as well as the cheek and jawline area. And in the post picture, which is taken after 5 months and a series of VI peels, you can see the clear skin, removal of those areas of sun damage, and some of the lines and wrinkles.
The silk peel is a really fun procedure and one of the most common procedures that our estheticians use in our med spa. The silk peel exfoliates, infuses, and rejuvenates the face with their proprietary method. There are different infusions that you can choose from, which can include an antioxidant vitamin C, a hydration, or a brightening complex. Microchanneling is a technique of infusing different products into the skin to help with the signs of aging, brightening, reducing dark spots, and overall rejuvenating the skin. It can be used with PRP or growth factors to improve the texture and thickness of the skin.
At Ahava Med Spa, we offer a number of different lasers for laser skin rejuvenation. The different lasers have different wavelengths that target different layers of the skin or remedy problems that come up, such as pigmentation, wrinkles, acne, psoriasis, and red or brown spots, as well as rosacea. We also have lasers that help with skin tightening, as well as one of the best lasers for hair removal. One of the latest and FDA approved most advanced machines for facial skin tightening is All Therapy. If you are looking in the mirror and feel that your face is sagging, but you're not ready for a surgical procedure, the All Therapy may be the right treatment for you. All Therapy uses focused ultrasound to tighten the deeper tissue below the skin. All Therapy requires no downtime except the day of the treatment. Its effects continue to improve for 6 months after. It can be used on all areas of the face, such as the brow, cheeks, jawline, and neck, and it can be repeated every 12 to 18 months. Your provider can examine you and discuss the options of treatment and see if you are a good candidate for All Therapy.
Thermiva is a convenient radiofrequency treatment performed in the office. Excessive relaxation of the vaginal muscles is a common occurrence after vaginal birth or due to aging. Damage can diminish sensation during intercourse, reduce sexual satisfaction, and change the relationship between partners. Laxity of the skin is caused by numerous factors, and no area is immune to this natural decline. How does Thermiva work? Well, it applies Thermi technology to either the labia or vaginal walls to stimulate cell reproduction, reversing the aging process. Radiofrequency energy is sent to the desired area, heating the tissue and stimulating the body's own collagen. It's clinically proven that tissue shrinks and collagen is stimulated with temperatures between 42 and 45 degrees Celsius. With over 115,000 Thermiva treatments performed worldwide, it is one of the real self most worth it patient's choice treatments. It is non-invasive, non-ablative, non-surgical. There's no anesthesia required, no hormones, no downtime, and it's delivered at your comfort level. Don't forget to follow us on Instagram at ahava.medspa or at Inland Cosmetic Surgery and mention us on your stories while you're here. Also, don't be shy to ask any of us questions regarding any treatments or services that we offer here.
We hope that you enjoyed this educational presentation. If you have any questions, we will be happy to discuss them with you. Our goal is to help you achieve the best results possible under a safe and comfortable condition.